neither on anybody else. We want an independent student. We want a learner. We want a learner. We want a hunter. We are not interested in a student on a receiver. So we want to create a student that is able to go and becoming a physician who is a learner, is able to hunt for knowledge. And creativity is supported. I'm sure most of our generations, I'm talking about my generation, myself, we have a lot of indoctrinations, being sitting in the school, sitting in the chair, and then teachers are teaching us, giving us information, a piece of information, and we cannot question these informations. We take it as a grant, we take it as a fact, even if it is not, but we're taking it as a fact. We want the students to be more than that. We want the students to be able to question, to analyze, and to criticize information. So this was one part of our hope, and then instead of having a student receiver, we want to be a hunter, as I mentioned before. So this is a model that we were interested, and we're trying to incorporate in our model. If you're looking there at teachers' time, for example, this is the time spent in the education process. And instead of teaching or lecturing for about 50% of the time, we want the teaching or lecturing to be 20% or 15% of the time, and the rest of the time, the teacher is helping the students to learn the tools, to learn the skills, not to memorize the information. So this was very important for us, and then maybe trying to certify. And this is happening for the past 3 years. We have what is called problem-based learning. So students are the center, they are having the discussion role, maybe 15 or 20 students, and the teacher in the middle, but he is not managing anything except certifying and trying to make sure that they are going within the right procedure. This is the different kinds of multimedia modes. I'm sure most of you know that we have synchronous and asynchronous. So we have synchronous and asynchronous in our model. You're going to see later on. And we have also video and text incorporated in our model. So why do we need e-learning in medical education? Here is a question. When we started our strategy, why do we need e-learning in medical education? We have so many challenges that pushed us very hard to go for e-learning and integrated in medical education. One of them is the ratio between the teachers and the staff. This was a very problem because we have very limited resources for professors in College of Medicine. And that time we have only 4 College of Medicine in the Kingdom of Saudi Arabia. We are talking now about more than 20 College of Medicines. So we are having witnessing a lack of teachers and professors. And then, as I mentioned, the out of focus, students are not able to absorb most of the materials being presented during the time. And then even the way of delivering a subject using traditional way or overhead projectors or even a projector, it is not the best way to present for, especially in education, especially for medical education. This is not the best way to do it. And also the same as for the subject as I mentioned, and also the limitations of this way for the creativity. If I have, for example, in a class 100 students, 50 students, and then I'm having 1 hour to deliver my subjects, I don't have enough time to discuss issues with the students. I don't have time to answer questions with them. I don't have time even to raise issues. It is very important to improve and work on the critical and analytical skills for the students. So lecture-based approach is not the best way to work on these skills for the students. So what we did, we were working on different, as I mentioned, we have the preclinical, we're going to mention now. So we have live cases, and this is very important. These are some of the examples that we've been thinking when we were designing our medical educations, that we have live cases, especially cases coming to emergency department. These cases sometimes are very important, and I want my physicians, my future physicians, to be able to have access. And I cannot get 100 students or 50 students or even 10 students around a life-threatening case. So this was one of the areas. Also the OR education, the operation room education. It was having a high risk for the patients, having groups of students every time. We have 15 students in the OR. So every time we go, and they are hardly able to see. They are hardly able to follow the surgeon. They are hardly able to witness any of the OR procedures. And also we have the atypical cases. Sometimes we have cases which is not normal. So in medicine, there is well-established cases, illness cases, but sometimes we have atypical cases. So we want to be able to document these cases for our students and future.
5 minutes.
5 minutes. Okay, I have to. Also, we have the number of students raising the cost, reduce the funding, and also, as you know, Saudi Arabia is so big. And then we have the competitions. Now we started to have private medical schools, and then we have the nature of medical education. All these pushed us to consider in our strategy to incorporate e-learning in our strategy for medical education. So as I said, we have the clinical teaching. So we have in clinical teaching, the examples we are using nowadays for the past 3 years, we are using diagnostic problems. So these diagnostic are simulated problems. They are computer-based problems that students are able to go into the system and follow the diagnosis, and then he's able to do the diagnosis and get the feedback. We have the simulated patients, the dummies, and then we have the live cases, and I'm going to show you how we are doing our live cases, and then decision-making support, and also we have clinical cases. So in medical education, as you maybe I witnessed this way of education, that I have my professors drawing on the overhead projectors, and then we are coming to that level, and then we came to a further level, and now we are coming to what is called virtual reality. And this virtual reality is happening. Now we have a virtual reality center in the College of Medicine in King Saud University. It's been there for 3 years, and it's so amazing. We were dreaming of that maybe 4 or 5 years ago. So the main objective is trying to implement and integrate whatever tools available in e-learning into the medical education to overcome challenges we are facing and improve the education process to get up with the best future physicians. We have different systems. The purpose of this study was trying to incorporate also the hospital systems. As you know that medical students from day one, they are working in the hospital at the same time trying to access patient information, patient radiology, x-rays, lab tests, and so on. So we tried to use this information system incorporated into the medical e-learning system. So we have hospital information system, patient systems, we have the PACS. PACS has all the patient's radiology images, and we have the electronic medical records. And the last system we have there is the operation room control system. This is a full recording system for the OR procedures, and then in the same time broadcasting the OR procedure I'm going to show you now to students in the theaters or in auditoriums. So this is what we are trying to do. We have the student in the middle. All other systems, in addition to the e-learning or the video on demand. I'm sorry, the time is not enough for everything. Okay. So we have the project. This is the phases of the project, integrating different elements, encouraging a student to use it, and we have the support part of it. So we started with a smart classroom. In the smart classrooms, we have the smart boards, we have the video conferencing, so we're able to record the professor's lectures and put it on the live on-demand server. At the same time, recording all the OR procedures and put it also on demand. Nowadays, we have 3,000 hours of OR procedures that is on our demand servers. I just go quickly because of time. So we have now even the database, the journals, application, digital library, simulations. This is the look of the system. So as you see here, we have the automated classroom down there, the e-learning systems, the video portal, and then we have a medical portal for the students, and they are able to access these 4 hospital systems from within their e-learning system. We have done a couple of studies to assess students' readability for ICT and also for our staff to be before starting our. And these are the phases of our projects. Now we are in the last phase, which is authoring, trying to work on our content. 1 minute. Maybe I can show you something here. Just this is a little video. If you don't like to be in OR, don't just close your eyes, please. But this is real. We are broadcasting these videos to our students nowadays. So these are broadcasted live from the operation room. Magnification is 150 times. So students in the auditorium, they're able to see the OR live, and then the consultant or the surgeon is explaining the procedures with the Hamlet. At the same time, we have 100 or 50 or 200 students staying in the main auditorium instead of taking them into 5 or 10 groups and also risking the patient's life, and I'm not giving them enough. And at the same time, we are recording this stuff and put it in on our server for future referral. Just giving my conclusion, Mr. President. So the conclusion, so the success in our beliefs is just focusing on the student needs. It's very important to focus on the student needs, not on the technology, not on the materials, not on the process. We need to focus on the student needs. This is the importance, not only to work for the technology, trying to make the educational and e-learning effective and attractive at the same time. Make it effective and attractive. And then we believe that e-learning is there to augment and support and enhance traditional education, not to replace it. So we are not trying to replace a traditional education. We want to augment and support. Thank you.
Thank you. Thank you, Dr. Ahmed, for shedding light on this experience, which really integrates complex systems into everyday life, and particularly in medicine is not an easy thing to do. والآن معنا تجربة أخرى وبشكل مختلف مع الباحثة فادية سالم الورفلي. حاليا هي طالبة دكتوراه بكلية التربية بالجامعة الماليزية الوطنية، قسم المناهج وطرق التدريس، وكانت بالسابق رئيسة قسم معلم فصل ورياض أطفال بكلية المعلمين في مدينة في ليبيا. نرحب بضيفتنا الثالثة اليوم.
عندما نريد أن نتكلم على التنمية المهنية للمعلمين حتى يصلوا إلى مستوى عالي من الكفاءة، يجب أن نتطرق إلى نقاط مهمة جدا، وهي مسألة تدريب المعلم قبل الخدمة وأثناء الخدمة. وأنا أقصد بذلك قبل الخدمة أثناء تواجده بكليات إعداد المعلمين المعلم الطالب، وأثناء الخدمة أثناء مزاولته للخدمة. في مرحلة ما قبل الخدمة التعليمية تكون هناك الخلفية الأكاديمية التي يتلقاها مع جزء بسيط من جانب التربية العملي. نأتي عندما ينتقل ويزاول مهنة التدريس وينتقل إلى الحياة العملية الواقعية، وهنا تأتي مرحلة أثناء الخدمة. قد يتساءل البعض بعد أن تلقى الخلفية الأكاديمية هل يحتاج المعلم مزيد من المعارف حتى يستطيع أن يصل إلى مستوى عالي من المهارة؟ نعم، تعتبر مرحلة أثناء الخدمة التعليمية أي مرحلة مزاولة المعلم لمهنته مرحلة مهمة جدا، ولعل أضعف الأسباب هو تحديث خبراته في مجاله. إن كان في مجال الرياضيات والعلوم يجب أن يكون مطلع ما هو الجديد في هذا المجال. وهنا نأتي إلى نقطة مهمة، وهي تدريب وإعداد المعلم في مرحلة أثناء الخدمة التعليمية. وحتى لا تكون عملية تدريب وإعداد المعلم عملية عبثية، يجب أن تكون مقننة ومبنية على أصول علمية. يكون ذلك بأبسط الأشياء، ونحن درسناها في مسألة إعداد المعلمين، أن نحدد ما هي أهم الاحتياجات التدريبية التي يحتاجها المعلم في هذه المرحلة أثناء الخدمة التعليمية. وهنا انطلقت هذه الدراسة تناولت تحديد الاحتياجات التدريبية أثناء الخدمة التعليمية بشكل عام في المرحلة الابتدائية بمدينة بنغازي في ليبيا. تعتبر التقنيات التعليمية للتعليم الإلكتروني جزء أو مجال من هذه المجالات.